Hello guys, welcome to Mark Africana. Today we are going to talk about self-breast examination to check for any lumps, any abnormal nodes or swellings on the breast. It's usually done as a screening for breast cancer. And being a breast awareness month, we are encouraged to do a self-breast examination because this is one way of screening for breast cancer. So in self-breast examination, this is an examination that is usually done once in a month on day 5 or 6 of the cycle. And most often you can do it when you are busy on alternate months. That means you can do it this month, skip next month, and then do it the next month. So in breast self-examination, here we encourage each woman, or rather each lady, to know how to do it, and this is how it's normally done. You stand on a mirror in the morning, most probably on the 5th or 6th day of the month. That is if you have a 28 month cycle. On the 5th or on the 6th day, that is when it's advisable for you to do the examination. You stand in front of a mirror, you raise your hands up. I can do it by demonstrating. When you raise your hands up, you check for the alignment of the nipples. That is, the nipples, both the left and the right, should be well aligned. Then you check for the appearance. Your breast should have similar appearance in terms of size, and in terms of there should be no swelling, no redness. You may find some places which are reddened, or you may find one breast which is bigger than the other. So in your normal breast examination, what you should check first is the appearance. That is, you stand in front of a mirror, you check, you look at them, you check for any abnormalities, that is excluding birthmarks. And the alveolar region, which is normally darker than the rest of the breast. After that, you take one hand, you place it on the back of the head. That is, if you are examining the left breast, you take the right arm. If you are examining the right breast, you take the left arm. For example, I can do it by demonstrating. If you are examining the right breast, then I will put the left arm behind my back. When I do like this, then you start your self-breast examination, still standing in front of a mirror. You take your 3 fingers, that is the middle, and the 3 fingers. You don't use the tip, you use the palm of the fingers to palpate, starting from the armpit in a clockwise region up to the collarbone, down in a clockwise way, looking for lumps. Lumps are normally swellings, hard knots that you find inside the breast, which are normally benign. So I can do it by demonstrating like this. You take your right arm, you use your right arm to examine your left breast. You start from the armpit region, because this is where the breast muscle reaches. Start from here, you palpate in a circular motion with equal pressure, so that you are able to determine any abnormality, any area which is more harder than the rest of the breast. Meanwhile, you do it round to the collar region, round, coming up to the alveolar region. Then when you reach at the nipple, you should press either for any discharge or pain. After finishing, you turn it to the opposite breast. So you go to the left breast, you go to the right breast, you use the left hand. You do the same thing. You start from the armpit, you palpate down in a circular motion up to the collar region. You come up to the alveolar, then you finish by pressing the nipple for any discharge. Normally in a breastfeeding mother, mothers who have just finished breastfeeding, you will find some milk will come out, but it shouldn't be very painful. But for those who are not breastfeeding, you may find either pus, which is an abnormal discharge from the breast, which should raise concern, or as you palpate, you may find hard mass. So in case during your examination you find anything abnormal, then you should report it to a doctor. And normally we encourage that during self-breast examination, this one should be done hand in hand with regular checkups with the doctor, because sometimes you may find a lump, but you're not sure whether it's a lump. So regular visits to the doctor are very necessary. And then during also self-breast examination, we also encourage that you can go to the bathroom, you soak your hand with soap. As you do the examination, it increases the sensitivity as you palpate round to the nipple region. And another point is, for women above 35 years old, we encourage monthly, not alternate, checkups of the breast examination, and those with history, family history of breast cancer. And if possible, they should do a mammogram at least once in a year for those above 35 years old. Otherwise, we wish every lady a cancer-free life and encourage them to do self-breast examination, because this is the only way we as ladies can screen for breast cancer without even consulting a doctor on a daily basis. Yeah, thank you. In Mark African, we have a group of nurses. We offer nursing services that is home-based nursing care to our residents in Kisinyamira and Oyugis. In general, we offer the following. We do home dressing, we do drug administration, we do psychiatric care, we do diabetes and hypertension care, we do nutrition care. We also offer health education, and in general we do all the nursing duties, nursing responsibilities. That is, we do wholesome care to our patients. So if you want any help, we are reachable on our YouTube, on our email. You can contact us, you can get, so that you get help wherever you want. On that, we charge a small fee, which is affordable, negotiable, and patient-oriented. Welcome.